Government Benefits Part 2. In this section, we're going to discuss the government benefits which particularly deal with health and health care. We're going to be looking at Medicare and Medicaid, or as it's known in California, Medi-Cal. This has been a particularly hot topic in the country, and as you know, we have some severe issues around policy regarding health care. So let's find out what exactly we have going on today and where the health care debate is going to continue in the coming year. The first program we're going to go over is called Medi-Cal. Medi-Cal is called Medicaid if you're in another state outside of California. What Medi-Cal does is it helps pay for medical costs for qualified low-income individuals. The medical costs that it covers must be with certain providers who actually participate in the Medi-Cal program. So you're not able to actually bring Medi-Cal to any doctor that you want and have it covered. The provider must be participating in the Medi-Cal program. Additionally, the services must be approved as medically necessary if they are going to be inpatient services, and that will be determined by the Medi-Cal program whether or not the procedure was quote-unquote medically necessary. Medi-Cal is administered by the states, but it was established by the federal government, so the money comes down to the states, and you will go to your local county social services office in order to apply for the program. There are two ways to be eligible for Medi-Cal. If your client can automatically be eligible, that is always the fastest way. You can be automatically eligible in 4 ways. If you currently receive SSI or Supplemental Security Income, if your client is already on that program, then they're automatically eligible for Medi-Cal. Similar for CalWORKs. If they are already enrolled in CalWORKs, they will already be automatically eligible for Medi-Cal. If your client is receiving refugee assistance or assistance benefits through a foster care or adoption program, they will also be automatically eligible for Medi-Cal. If you're not automatically eligible, then clients can file a written application to see if they can get in through applying. They must have a limited income and limited assets, which means that they have under $2,000, not counting their car and their home. In addition to being low income and low asset, they must have a particular condition which Medi-Cal considers for eligibility. They must be a parent or caretaker of a child under 21 who's living at home. In that case, the other parent must be deceased, unemployed, or absent. Or your client can be under 21 or over 65, or they can be disabled or blind. They can be diagnosed with cervical or breast cancer, be pregnant, or be a refugee in the United States for less than 8 months. They can also be living in a skilled nursing or care facility. An important note is that on January 1st, 2014, there are going to be new implications for eligibility for Medi-Cal. The first is that the asset limitation is going to disappear, and so that's going to open up the program to a lot more individuals. Secondly, the requirement of disability is going to disappear. So really we're looking at most low-income individuals having access to the Medi-Cal program beginning January 1st, 2014. By the way, I should mention that because your book was published before we got that handed down, those particular parts will not be in your book, the new things that come in 2014. So make an extra note of those. So what you're going to see are different clients coming in and trying to figure out, well, I may be eligible for a couple of different programs. What is it that I should apply for, and what is it that I can actually get? Many different individuals, as you can see from automatic eligibility, are enrolled in many different programs at once. We call this the benefits cocktail. It's the different parts of benefits which are mixed together to create a package for the client that's going to help them succeed on their various programs. Now let's look at Medicare. Medicare helps seniors and some disabled folks pay for medical costs. The administration of this program is by the federal government at the CMS, which is the Centers for Medicare and Medicaid Services. There are 4 different parts of Medicare, and we're going to talk about them each individually when it comes to eligibility. Part A is a hospital insurance segment, Part B is medical insurance, and Part D is prescription health coverage. So if you've ever heard of just people talking about Medicare Part A or Medicare Part B, it's because they're actually different programs that are all rolled into the Medicare system. There is also a Medicare Part C, which is the Medicare Advantage plan. However, it is far less popular than the other 3 parts, and that's because it runs like an HMO or a PPO. It's offered by the private companies, so private companies would offer you Medicare Part C as well as possibly other options, and employees would be able to choose Medicare Part C if they liked. This particular cartoon stresses the fact that Medicare Part C has not been very popular. It's 2 gentlemen walking together where one says, "Have you heard about the new Medicare drug plan called Plan C? Medicare gives you $30 for a bus ticket to Canada." Medicare Part A is hospital insurance. And again, we're looking at 2 ways to be eligible, either automatic eligibility or through application. So here's how to be automatically eligible for Medicare Part A. Your client can be 65 or older and be eligible for Social Security retirement or civil service retirement benefits. Your client can be under 65 but entitled to Social Security disability benefits for 24 months or more. Your client can have permanent kidney failure, which requires dialysis or a kidney transplant, and have worked a required amount of time in Social Security, in a job, that was covered by Social Security, and so building up those work credits. Or the client's spouse could have done this and built up work credits over the time that he paid into Social Security or she paid into Social Security and built up those credits. So Medicare Part A hospital insurance can also be applied for. In order to apply, what you're applying for, if you're accepted, you will be paying monthly premiums of up to $450. The exact amount is going to depend on the work credits which were accrued during the person's employment. The premium itself is going to increase for 10% for every year after your 65th birthday that you have not yet enrolled. So in other words, if at 65 you're eligible to enroll for Medicare Part A and you choose not to, which is perfectly fine, if you're going to go for applying at 66, you decide when you turn 66 that you're going to apply for Medicare Part A, the premium that you will have paid at 65 years old, you will now be paying 10% more because you decided to apply at 66. So similarly, if you were going to apply at 70, then you would be looking at 10% for each of those 5 years of an increase in your premium. Clients will also pay an initial hospital insurance deductible. So like most insurance that we have in this country, there is an initial amount which will have to come out of the pocket of the client before the insurance will actually pay for anything. This deductible is also going to increase every year that the client is enrolled in the program. So what do you get for this money? Medicare Part A will pay a portion of hospital and inpatient costs. It will only pay for hospital and inpatient costs which are medically reasonable and necessary, and that's their term and their definition. It'll pay for hospital and skilled nursing facilities, but they must be improved by Medicare and accept Medicare payments. So they must be one of those providers that we mentioned who opted into the program. And then the specific care must be prescribed. So whatever it is which is being billed must be something which was prescribed by the doctor or the hospital or nursing facility, which is a provider of Medicare, and that specifically medically reasonable and necessary treatment must have been prescribed, and then it is eligible for Medicare Part A insurance to kick in and pay for that if you're over your deductible. Medicare Part B is medical insurance, and this is for folks who are 65 years or older and U.S. citizens or lawful permanent residents with a green card. They must have had this for at least 5 years. In this case, you actually have to enroll. There is no automatic eligibility, and so folks who are enrolling will pay a monthly premium, and they'll also pay the annual deductible. Just as we saw in Medicare Part A, the monthly premium is going to be raised slightly over time, and so every year in Medicare Part B, there will be an increase in that premium. What you buy with Medicare Part B is a payment for a fraction of medical bills. Medicare Part B pays for 80% of what it considers to be a reasonable charge for a doctor's services. You can see how this could create a few problems. You can see how perhaps the doctor would charge a certain amount, and then Medicare Part B would come in and say, you know, that is not a reasonable charge. This doctor charged you $400 for what should have been $200, and so we are going to pay 80% of the reasonable charge. So we're going to pay 80% of the $200 and not the $400 bill. And so you can see how there could be a gap between what the patient is actually paying and because of what the doctor is charging and what Medicare Part B is willing to pick up. Important also to know what Medicare Part B does not cover. It does not cover anything not quote-unquote medically necessary. It does not cover any alternative health care, so acupuncture, homeopathic medicine is not going to be covered. Interestingly, it doesn't cover vaccinations and immunizations. That one I can't quite wrap my head around, but no shots are going to be covered with this medical insurance, and no drugs, prescription or otherwise, if you could administer and take them yourself at home. So if they come in a form of a pill, which you would be able to swallow with your breakfast, this will not be covered by Medicare Part B. Routine eye and hearing exams, glasses, contacts, and hearing aids are also not covered, nor is general dental or periodontal work or routine foot care. So as you can see, this leaves us with quite a question of what exactly we're paying for, and there's no question as to why healthcare reform in this country is such a hot topic. It really is something which we're not looking at giving a product which is going to work very well for very many of the clients who we'd be referring there. Lastly, let's talk about Medicare Part D. Part D is the prescription drug coverage portion of Medicare. It covers some of the costs of prescription medications that you take home. So this is going to reduce some of the out-of-pocket costs that you're going to pay. However, just like the other portions of Medicare, you're not looking at 100% coverage. Medicare Part D is actually administered through private insurance companies. Private insurance companies sometimes offer Medicare-approved prescription drug plans, and so those are the particular drug plans which you would be looking at. Additionally, Medicare Part C plans sometimes include a Part D benefit as well. So how could you be eligible for prescription drug coverage under Medicare Part D? Well, first off, if you qualify for Medicare Part A, you qualify for Part D. If you are enrolled in Medicare Part B, then you qualify for Part D as well. For people who are on Medi-Cal, it is a mandatory program to be enrolled in Medicare Part D. What are you going to get with Medicare Part D? Well, you're going to pay a monthly premium. Well, so we've heard this before. It's about $10 to $50 a month. And then also an annual deductible, so the amount that you're going to have to pay out of pocket before Medicare Part D kicks in and covers the rest. You will pay a co-payment for each prescription filled. This is about a quarter of the amount that's going to be charged. There is a low-income subsidy which is going to reduce this, but you can see how with monthly premiums and deductibles and co-pays with Medicare Part D on top of Part B and Part A, how this is really going to ramp up in terms of cost to the client. The drugs which are covered under Part D are all listed on what's called a formulary, and so only those drugs which are listed on the formulary can be covered. And then we see a financial penalty for delaying enrolling, just as we saw previously. For each month where you delay enrollment, there is a 1% financial penalty, which is going to increase. So this is one artist's rendition of the Medicare system, and we've often heard it referred to in the media and popular culture as just a maze of a healthcare network that is definitely in need of reform. And so we see with, for example, the Affordable Care Act, an attempt to overhaul the system and really change the way that we look at healthcare in this country, how we fund it, and how folks who participate in a healthcare system that we have and government benefits which provide healthcare can really go into a system which is going to benefit them and they're going to be able to actually afford. And so this is why it's been such a hot topic, and this is why Congress has really been chewing over this, is because the current program that we have now is really quite not only confusing for some folks, it's expensive for others, and it doesn't cover everything which is needed that a health plan needs to cover. And so there's really been a lot of talk over some time, as you probably know, about what we can do to fix that and how we can fix the Medicare system in particular. And so that's what we're going to be looking at politically over the next couple of years as we implement the Affordable Care Act and we see what type of effect that's going to have on the existing healthcare apparatus we have in this country. So just a takeaway for Medicare and Medicaid, the differences between the two. Important to remember that Medicaid provides medical care to the poor, while Medicare provides health insurance for the elderly and disabled. And then it's important to know how these things are funded. Medicare is a hospital insurance which is funded by tax or other services and paid for by a premium, while Medicaid is looking at jointly funded programs that are funded by the national government and the state governments. So while we're looking in Medicare by not only hospital insurance, but the different programs and plans which Medicare covers, we're looking at ones that are funded there not only by the government, but funded by people. I guess technically you can look at funding by the government being funded by people because we're the taxpayers who pay to fund the government. But we're not only looking at that funding, we have to remember premiums exist there as well as the deductibles, which are going to kick in some money there. Whereas Medicaid, so when you're looking at the Medi-Cal program, you have a slightly different situation because of the funding coming from both the national stream and the state stream, which are able to keep that program afloat without the need for such heavy funding by premium.